America's largest healthcare city is facing a growing crisis. Thousands of nurses have walked off the job across major New York City hospitals, triggering one of the biggest healthcare strikes in recent years. The strike began after marathon negotiations through the weekend collapsed without a deal. Hospitals hit include New York-Presbyterian, Montefiore, and Mount Sinai. The nurses' union says nearly 15,000 nurses are participating, demanding safer staffing levels, better workplace security, and limits on the use of artificial intelligence in hospitals. Hospital management, however, says the union's demands are simply too expensive. The strike involves private, non-profit hospitals, not city-run facilities, but its political impact could be significant. This is an early test for New York City's new mayor, Zohran Mamdani, a democratic socialist who campaigned on a strong pro-worker platform. Mamdani visited striking nurses at the New York-Presbyterian picket line Monday, siding firmly with them. These executives are not having difficulty making ends meet, Mamdani said. He praised nurses for their work and said they are fighting for dignity, respect, and fair pay and treatment they deserve.
At every one of our city's darkest periods, nurses showed up to work. Their value is not negotiable, and their worth is not up for debate. We know that during 9/11, it was nurses that tended to the wounded. We know that during the global pandemic, it was nurses that came into work even at the expense of their own health. They showed up even when we didn't have protective equipment for them. They showed up even as others were staying home. Bottom line, they showed up. We are here today where we do not want to be, but where we must be, on the picket line, marching for justice and fairness, standing in solidarity alongside those who have done so much for the people of this city. This strike is not just a question of how much nurses earn per hour or what health benefits they receive, although both of those issues matter deeply. It is also a question of who deserves to benefit from this system. There is no shortage of wealth in the healthcare industry, especially so at the 3 privately operated hospital groups at which nurses are striking, the wealthiest in the entire city. The CEO of New York-Presby, where we are today, made $26 million last year. But for too many of the 15,000 NYSDA nurses who are on strike, they are not able to make their ends meet. They are not asking for a multi-million-dollar salary. What they are asking for is for their pensions to be safeguarded, to be protected in their own workplace, to receive the pay and the health benefits that they deserve. New Yorkers have a right to quality health care, as do the nurses who provide that care. My job as mayor is to protect both of those rights.
Other Democratic city and state leaders also showed up to support the nurses. New York Governor Kathy Hochul sent state health officials to monitor patient care during the strike. In a statement, Hochul urged both sides to negotiate a deal that recognizes the essential work nurses do. The timing of the strike has raised serious concerns. It comes during a severe flu season and could force hospitals to transfer patients, cancel procedures, or divert ambulances. City hospitals not involved in the dispute could also feel the strain as patients avoid facilities affected by the strike. The nurses' demands vary by hospital, but 2 issues dominate: staffing and safety. The union says nurses are being assigned unmanageable workloads that endanger both patients and staff. They are also calling for stronger security measures. The concerns followed a disturbing incident last week when a man armed with a sharp object barricaded himself inside a Brooklyn hospital room and was later killed by police.
The strike is about getting a fair contract for safer staffing and also sticking to our health insurance, which is what Mount Sinai is trying to pull from us. It feels like a slap in the face. I mean, nurses here during 2020, like we worked the floors and we sat by our patients while management was not around to be seen. And now that's how they're treating us. They don't want to give us a fair contract and they don't want to give us safe staffing, and now they're trying to roll back on our benefits.
How can we as nurses be inside taking care of patients when we don't have health care? We need to have good health care so we stay strong, so we can go in there day after day. Nursing is a 24/7 job. We don't get a break. We're there to take care of these patients, and that's what we're going to do. But we need the health care to do that.
Hospitals say they have been working to improve staffing, but argue the union's overall demands are unrealistic. After nurses issued strike notice on January 2nd, hospitals hired temporary nurses and vowed to minimize disruptions. Montefiore assured patients that scheduled appointments would continue. Montefiore spokesperson accused the union of making what he called $3.6 billion in reckless demands. He claimed those demands include steep wage hikes and job protections even in cases where a nurse might be intoxicated on the job. He said the hospital remains committed to providing safe and seamless care, no matter how long the strike lasts. NewYork-Presbyterian also pushed back, accusing the union of staging a strike to create disruption. The hospital said it has taken steps to ensure patients continue receiving care and added it remains open to negotiating a fair and reasonable contract. Each hospital is negotiating separately with the union. Several other hospitals across New York City and its suburbs reached last-minute deals in recent days to avoid joining the strike. Both Governor Hochul and Mayor Mamdani had previously warned about the potential fallout if talks failed. This is not New York's first nursing showdown. The last major strike was just 3 years ago, in 2023, at Mount Sinai and Montefiore. That walkout lasted 3 days and ended with a deal that raised nurses' pay by 19% over 3 years, along with promised staffing improvements. But today, the union and hospitals disagree sharply over whether those staffing commitments were fulfilled. Now, with thousands of nurses on the streets, patient care under pressure, and political stakes rising, New York's healthcare system is once again at a critical crossroads. And the question remains, how long can the city hold the line?